If obesity is a disease, it is one that is manufactured by policy, sold by industry, and blamed on patients and their doctors. A century ago, the typical American family worried about rickets and undernutrition. Today, nearly 1 in 2 adults live with obesity, and 1 in 4 on track for severe obesity by 2030. Welcome to PCP Lens, where we journey through metrics, money, and madness. My name is Sudeep Bensal. I'm a primary care physician in Connecticut, and I run my own medical practice. If clinical medicine alone could solve the obesity problem, the billions of dollars that we've already spent on weight loss drugs, bariatric surgery, and BMI quality measures should have worked by now, or at least they should have partly worked. But it hasn't, and obesity rates keep rising. This is because obesity behaves less like a classic disease and more like a symptom of the modern economy, which is shaped by the political, commercial, and structural determinants of health. Let's dive in. First and foremost, let's define obesity. The WHO and NIH define obesity as adult body mass index of greater than 30 and severe to morbid obesity as a BMI of greater than 40. And yes, I know that BMI is not perfect. It ignores body composition, ethnic variation, and there are a bunch of other oddball issues associated with it. But BMI is the official measure that is ordained upon us to use today to define obesity. So the billion-dollar question is, why should we care? Obesity is important as it dramatically increases the risk of several health complications, which include cardiometabolic, which includes type 2 diabetes, hypertension, coronary artery disease, and stroke. Respiratory, such as obstructive sleep apnea and obesity hyperventilation syndrome. Liver complications, such as non-alcoholic fatty liver disease, which, by the way, is now the leading cause of liver transplant. Musculoskeletal complications, such as osteoarthritis and lower back pain. Obesity also increases the risk of multiple types of cancer and affects reproductive and psychosocial health, including infertility and depression. With this background, let's look at the factors that increase the risk of obesity. The first big factors are the social determinants of health. There's substantial data to show that obesity rates are distributed along socioeconomic status lines, especially among children and women. For example, 42% of women living below poverty line are obese, as compared to 29% women with higher income levels. And 19% children in low-income families are obese, compared to 11% in high-income families. For men, the data is much more mixed, and those with higher income, especially men in high-stress and sedentary jobs, are much more likely to be obese. And then there are other environmental influences such as neighborhood safety that limits outdoor activity, housing stability which can disrupt daily routines, especially when people are evicted from their homes, and other chronic stressors that can alter eating behaviors. The social determinants of health create a metabolic 1-2 punch where unhealthy surroundings activate metabolic stress pathways, and that increases the risk of obesity and downstream health complications. If you've ever craved sugary food such as chocolate when you're stressed, imagine living in a situation all the time. This table shows you some other socioeconomic determinants of health and how they increase the risk for obesity. Feel free to pause and review. And if you're listening to the audio podcast version, this table is also in my written article on pcplens.com. Now let's look at the commercial determinants of health. Fast food industries, to make more money, deliberately engineer food products that make people eat more. Now, I'm not a food scientist by any means, but my understanding is that these companies use high concentrations of sugar, fat, and salt, along with other ingredients. The combination of these ingredients disrupts our body's natural regulation that satisfies hunger, which tells us when we are full and that we don't need to eat anymore. These hyperpalatable foods are engineered to hit what's called a bliss point. This sensory bliss point is when the brain releases maximum amount of dopamine, which induces cravings to eat more of that food. This is exactly what happens when people get addicted to gambling, alcohol, and drugs. There are several studies in the literature that have documented this phenomenon, but let's look at one such study. When people are given ultra-processed food compared to unprocessed food, people ate approximately 500 calories more per day and reported similar fullness levels. Now, this was just a small study, but just think about how much food you eat when the plate is mainly fresh vegetables compared to eating out in a restaurant, especially a fast food restaurant. Now, after food scientists working at these big companies have created these hyperpalatable food products which make you addicted, it needs to be sold to people. This is where marketing comes in. Now, who do you think is an easy target for these kinds of hyperpalatable addictive food products? People with higher education status and income who can afford fresh food, or people with limited education and financial means who are just trying to make ends meet? The return on investment is always higher when it's targeted to people with limited means. And these companies have several tricks up their sleeve that is designed to change behavior to get people addicted. For example, Maslow's hierarchy appeals to basic and psychological needs such as hunger, belonging, and self-esteem by associating fast food with comfort, convenience, and social bonding. The ELM model, or the elaboration likelihood model, leverages superficial cues such as attractive visuals, jingles, and celebrity endorsements, rather than rational arguments. Think about it this way: if my favorite celebrity is eating this food, then it should be good for me. Essentially, this is weaponization of trust in celebrities to sell addictive food products. The IDA model, that is the attention, interest, desire, and action model, is used to create ads that first grab attention, such as bold colors, then build interest and stimulate desire, such as sizzle sounds, beautiful close-ups of food, and when people reach that high impulse stage, then use a clear call to action to trigger a purchase. This is a technique that leverages impulse control to get people to buy ultra-processed food. And guess who has the lowest impulse control? Children. These techniques, such as the IDA, target children to get them addicted to sugary foods, making them customers for life. Also, this is the reason why McDonald's has playscapes in its restaurants. For people living in poor communities with no place for children to play, McDonald's is the default option. And then we blame people or parents for taking their kids to McDonald's. Also, we live in a world where data is collected and used relentlessly for marketing purposes. It is sliced and diced to figure out who is the most likely person to buy the product, and then they are targeted using a multi-channel strategy such as social media, email, flyers, and now also ads on video streaming services. So essentially, once you have identified or have a cohort of vulnerable people most likely to eat unhealthy food, they are bombarded with ads to change behavior to get them addicted. In my prior video on the commercial determinants of health, I talked about how the soda industry funnels people from tap water to sugary drinks. I'm including that section next. If you've already watched it, feel free to skip ahead to the next section on how political determinants increase the risk for obesity. Companies advertise bottled water as pristine, natural, and purified, linking it to being better for health and is a status symbol. This narrative positions it as superior to tap water. While rarely making direct false claims about tap water, which could lead to legal issues, the industry capitalizes and amplifies public concerns about tap water quality, such as lead in water, water needs to be boiled before it's safe to consume, or tap water has a chlorine taste, which indirectly implies that people are drinking chlorine. This two-pronged marketing approach suggests that tap water is bad and bottled water is good, which creates a market for bottled water. Since bottled water is expensive, companies place their high sugary drinks next to bottled water and price them lower than bottled water, and then also frequently discount them. When people with lower incomes who already have been primed that tap water is bad are looking for bottled water and attracted to the low price of sugary drinks and end up purchasing them, they then become addicted to sugary drinks and don't like the taste of water anymore and continue to buy soda. This is called manufactured consent. Now, let's shift gears and look at how political determinants of health increase the risk for obesity. Federal subsidies heavily favor commodity crops like corn and soy, which manufacturers use to produce cheap, ultra-processed foods, such as those with high fructose corn syrup, and hydrogenated oils. Economists continue to debate the direct impact of these subsidies on obesity. However, when you couple subsidized crops with highly efficient supply chains that bring them to the market, it can distort pricing. For example, the fast food companies have evolved their supply chains to take advantage of these cheap foods and bring them to the market at very low prices. This makes unhealthy food far more affordable and accessible than fresh produce. Commercial actors then use marketing strategies described above to market this food to vulnerable people. Once these fast food companies become large enough, they lobby lawmakers to make sure that they don't face any regulations, which can then impact their profits, such as taxes on sugary food and drinks, labeling food that is unhealthy, or restrictions on junk food advertising to children. And then we have zoning laws, which create a 1-2 punch for people living in low-income areas. Grocery stores don't want to build stores in these places due to zoning laws and because the higher-priced groceries may not sell as well. Fast food companies take advantage of these laws and donate to local politicians, and then cement these zoning laws in place to favor fast food companies. This then leads to clustering of fast food restaurants in these low-income areas, but no places to buy fresh food. Both the political and commercial determinants of health create the structural determinants of health, which leads to the emergence and persistence of socioeconomic determinants of health. I discussed this phenomenon in my previous video, the architecture of illness. Decades of redlining and residential segregation due to political decisions lead to clustering of low-income populations. Since local infrastructure is funded using property taxes, this leads to fewer resources and underfunded services in these segregated populations. And as I mentioned earlier, this can create a food environment that replaces grocery stores with fast food restaurants, with heavy marketing to change behavior to make unhealthy food the default choice. The table on this slide summarizes how structural determinants lead to the emergence of the social determinants of health, which can then impact obesity rates. Many of you may be thinking that eating unhealthy food is more of a personal choice and not something that's forced upon us. And there's some truth to that. However, there's also no denying that many vulnerable people only have bad options or are convinced by marketing techniques that the bad options are actually good for them. This might sound like paternalism to some of you, but then you could also argue that marketing is paternalism because it is designed to convince people what they should and should not do. Let's take the example of personal choice versus structural factors in determining obesity risk. Hyperpalatable foods are designed to get people addicted and are engineered in the lab, and then they're targeted towards vulnerable populations. Commercial actors manipulate policy and delay regulations that could minimize their profit from selling these commercial foods, all the while aggressively marketing these foods using emotional and behavioral triggers to change people's behavior. These factors then saturate the environment that low-income people live in, making ultra-processed food the easy choice. This normalizes consumption of unhealthy food, leading to the development of cultural norms, which in turn leads to chronic overconsumption and increase the risk of population-level obesity. And once a culture develops around overconsumption, it is very hard to turn the tide. This slide shows a mind map of all the determinants of health and how they can affect population-level obesity. The root cause of obesity is best understood using a pyramid. The base of the pyramid are the structural determinants of health, which include factors such as residential segregation, underfunded services, and food deserts. The next layer of the pyramid are the political determinants of health, such as policy decisions, zoning laws, and agricultural subsidies. Following this are the commercial determinants of health, which includes corporate marketing, fast food product design, price manipulation, and lobbying. These then lead to the emergence of social determinants of health, such as low income, low literacy, and healthcare access. All these factors compound to create the conditions for obesity and the chronic disease epidemic. This is why obesity is a symptom of how our society is structured. Blaming doctors for obesity is like blaming firefighters for house fires. This is also why quality metrics in nutritional education in your doctor's office will not change the rising obesity rates. We need to address the multifactorial determinants of health at its source if we want to curb the obesity epidemic. You can find a written version with references to this material and an audio podcast version on PCPLens.com. If you like this video, please sign up on PCPLens.com so that you don't miss the next episode when it's published. Thank you for watching this video. Take care and goodbye.